Hey there, and welcome back to part 2 of my Let's Pass NREMT video series. In this portion, we're going to be diving into the operations category of questions. We'll go over what you're going to want to know and study from this section, as well as some practice questions so you can be confident when you go in and take the exam. Let's get right into it. The main hitting points of the operations section are as follows: situational legalities, start triage, equipment, hazardous materials, and of course personal safety. Alright, we'll start with the situational legalities and work our way down to the things you're going to want to know right off the bat. Consents. The three types and their differences. We have express consent, which is a mentally competent adult saying, "treat me." We have minor consent, which relates to anyone under the legal adult age requirement. You have to have consent from a parent or legal guardian to treat these kind of patients. If you're unable to reach one, then we assume implied consent. Implied consent is basically how we handle everything where we don't get a yes from a mentally competent adult. So if someone is unresponsive or altered and needs to be treated, obviously they can't express consent. So we just imply that they want to be helped, hence implied consent. You may or may not see questions on this, but know the difference between assault and battery. Assault is the act or threat to inflict harm upon a patient. If you beat up your patient, or you threaten to beat up your patient, that's assault. Battery is the act of merely touching a patient without consent. If you don't get consent to treat somebody, you put your hands on them, technically that is battery. False imprisonment is the act of taking a mentally competent adult, one who's ANO4, against their will. If they're not ANO4, by NREMT, most EMS standards, they are not able to give consent for themselves, and that would technically fall under implied consent. Grabbing your boss, on the other hand, and putting him in the ambulance and telling him, "Hey buddy, you're going to the hospital," when he is ANO4 and states he doesn't want to go to the hospital, that would be false imprisonment. Abandonment is when an EMT begins care of a patient and then stops without transferring care to an appropriate provider. An appropriate provider by NREMT-B definition is anyone EMT-B or above. A paramedic or an RN would most certainly be appropriate, while a layperson with no medical training would most certainly not be. As far as confidentiality goes, NREMT aligns right alongside with HIPAA restrictions. My advice to you, when in doubt, don't give it out. If you can't see it on a person, don't say it about a person. While we can certainly physically see we have a mid-30s female experiencing respiratory distress, we can't see her social security number, name, date of birth, etc. without her physically handing it to us. Now let's tackle a practice question relating to this section. A 77-year-old female patient who has experienced a fall presents as unconscious. Given the information, which of the following best describes the situation? Our options are as follows. The situation merits implied consent. The situation is abandonment, as the patient cannot be treated. The patient is refusing care and EMS should attempt to obtain an AMA. The patient has a DNR order and CPR should not be initiated. So go ahead and pause the video, work through this in your head, and play when you think you've got the answer. Alright. If you got the first option as your answer, the situation merits implied consent, good job. If you didn't, don't worry about it. That's why we're here. Alright? This situation most certainly merits implied consent because our patient is unconscious and is not able to express her own consent. But we imply that she would like to be helped. Alright, let's look at the other options here and explain why they are incorrect. Option 2 says the situation is abandonment as the patient cannot be treated. Right? So we know the situation is not abandonment. We do have the opportunity to abandon this patient, but we're not going to do that. And the patient can most certainly be treated. Right? Option 3 says the patient is refusing care and EMS should attempt to obtain an AMA. Unless somebody is ANO4 and this patient is not, as she is unconscious and physically tells you, "I don't want to be treated," they are not refusing care. So the last option, the patient has a DNR order and CPR should not be initiated. NREMT likes to do this a lot. Nowhere in that scenario were we giving any information about a DNR, so this is going to be invalid. Our next point we're going to hit here is start triage. Triage is either super easy for you or you're super confused. I've noticed there's really no in between. For NREMT, you do need to know start triage, pertaining especially to the tag colors and when to tag patients a corresponding color during a mass casualty incident. I'll also link in the description the actual U.S. Department of State Health Services start triage flowchart, and I highly recommend you take a look at it. It is some good information. I'll make this super easy for you though. There's 4 tags. We have green, which is minor. Yellow is delayed. Red is immediate. Black is expectant, which means we're expecting them to be dead or unable to sustain life. So let's break it down as to when and which patients get what tags. The green tag. We classify these patients as minor, which means they'll likely have minor injuries, right? Right off the bat, if they're up and walking around, they get a green tag until proven otherwise. These patients are generally considered stable and unlikely to deteriorate in the near future. The yellow tag. We classify these patients as delayed. They do have serious injuries, but they're able to be delayed a couple hours before they become life-threatening. Examples of this might be minor extremity fractures, burns on less than 25% of the body, as well as controllable bleeding. The red tag. We consider these patients immediate, and they are the highest priority as far as start triage goes. They will typically have life-threatening injuries and need immediate transport. Automatic classifiers include respirations over 30, an absent radial pulse, cap refill of over 2 seconds, and the inability to follow simple commands. In addition to that, if we had a patient who was not breathing and we readjusted their airway and they had spontaneous breathing after that action, they are technically a red tag. The black tag. We classify these patients as expectant, which means we're not expecting them to live. Automatic classifiers for a black tag are injuries incompatible with life. Things like devastating head trauma, burns over 75% of the body, and no spontaneous breathing after giving 2 rescue breaths. So now let's try a practice question that we might see pertaining to this information. During an MCI, which of the following actions will be the most appropriate in accordance with the start triage methods? Tag an unresponsive 57-year-old male patient who is not breathing as red. Tag an unresponsive 3-year-old female patient with labored breathing 9 times a minute as red. Tagging a responsive 19-year-old male patient who's breathing 32 times a minute as yellow. Tagging a responsive 26-year-old female patient who's unable to follow simple commands as yellow. Go ahead and work through it in your head. Pause the video. When you're ready, hit play. We'll talk about it. Alright, so if you picked the second option with the 3-year-old female patient, good job. If you didn't, don't worry about it. Just keep studying. Alright, let's go through these one by one. Alright, the first option, tagging an unresponsive 57-year-old male patient who's not breathing as red, is wrong. Of course, we would try and give 2 rescue breaths to any patient who's unresponsive and they're not breathing, but we're not given that information in this question. This patient would technically be black. The second option, tag an unresponsive 3-year-old female patient with labored breathing 9 times a minute as red, is absolutely correct. Labored breathing is an automatic qualifier for red. Option number 3, tagging a responsive 19-year-old male patient breathing 32 times a minute as yellow. Remember, with respirations over 30, that's instantly tagged as red, so this one is wrong. Option number 4, tagging a responsive 26-year-old female patient who's unable to follow simple commands as yellow. Remember, the inability to follow simple commands, by default, red. That's the end of this particular video. We're going to be continuing talking about operations questions in the next video. If you liked this video, if it helped you in any ways, give it a thumbs up. If you absolutely hated it and you also hate baby kittens, leave a comment below. See you soon.